Most people start their day with this, coffee. But do you know if your morning cup of coffee really hurts your blood pressure? Or is it possible it actually helps? Yes, coffee. Is it helping your heart or quietly raising your blood pressure every morning? For years, doctors have told people with high blood pressure, cut the coffee, it spikes your pressure, it's bad for your heart. In today's video, I'm gonna dive into the surprising relationship between coffee, blood pressure. No Reddit myths or chiropractor claims, just solid data on coffee, caffeine, and your blood pressure. Hi, I'm Dr. Brian. What happens right after you drink coffee? Well, it's true that caffeine, the main stimulant in coffee, can cause an increase in both systolic and diastolic blood pressure. When you drink coffee, caffeine blocks adenosine. That's the chemical that helps your blood vessels relax. That temporary block makes your vessels tighten a little bit and your adrenaline levels rise. So for the next couple hours, your pressure can go up, usually just 2 to 4 points. If you're not used to caffeine, that rise can be higher, 5 to 10 points. But here's the kicker. For regular coffee drinkers, your body adapts, and that same spike all but disappears. The short-term rise is mild, temporary, and it's more like a heartbeat than a real heart threat. But how about for the long term? Does coffee raise blood pressure over months or years? There's a large study in the American Journal of Clinical Nutrition that looked at over 170,000 participants. And they found something that's kind of shocking. People who drank 3 to 5 cups of coffee per day had no increased risk of developing high blood pressure. Another more recent study in 2023 in the journal Nutrients found that habitual coffee drinkers actually have a slightly lower risk of developing long-term hypertension or high blood pressure. And this has been confirmed across the world. There's a 2022 study in Korea that looked at over 21,000 adults and found the same thing. People who drank 2 to 3 cups of coffee a day had a lower chance of high blood pressure compared to those people who didn't drink at all. So yes, your pressure might rise for a few hours after coffee, but long-term, regular coffee drinkers actually tend to have good or even better blood pressure control. Why is this? Think of coffee as a complex plant. It's not just a caffeine delivery system. Each cup contains over 1,000 bioactive compounds, things that we all hear about being very good, polyphenols, antioxidants, and something known as chlorogenic acids. These compounds do the opposite long term of what caffeine does in the short term. They reduce inflammation, they improve blood vessel flexibility, and they even enhance insulin sensitivity. All things that support healthier blood pressure over time. In other words, caffeine gives you a short rise, but the rest of coffee's chemistry quietly pulls your blood pressure back down, and oftentimes appears to leave your cardiovascular system better off in the long run. And sidebar, it's not just blood pressure. People who drink coffee in moderation, around 3 to 4 cups a day, consistently show lower rates of heart disease, lower rates of stroke, and lower rates of type 2 diabetes in large population studies. So we think coffee is good for you. That brings up the next question. I've told you moderate coffee consumption can actually help your heart and your pressure. But how much is the right amount? Well, because like most things in medicine, benefits sometimes depend on the dose. Both the FDA and the American Heart Association both land on about the same number, up to about 400 milligrams of caffeine per day. That's roughly 3 to 4 small cups or about 2 large mugs of brewed coffee. But, and this is important, that doesn't mean more is better, because once you push past 4 up into the 5 or 6 cups a day, the caffeine starts to work against you. It instead can trigger blood pressure spikes and palpitations and funny heart rhythms. And if you're already someone whose blood pressure runs high, that extra caffeine can actually nudge your pressure even more. Important disclaimer, if you're pregnant, these numbers don't apply. Keep your consumption under 200 milligrams a day. That's 1 small cup of coffee per day. So we know how much coffee you should drink, but does the type of coffee matter for your blood pressure? Believe it or not all coffee is created equal. How you brew it can make a real difference, and it's not in the way you might think. For example, dark versus medium coffee. The caffeine content actually drops slightly as beans are roasted darker. So dark roast coffee usually has a little less caffeine than medium roast, but darker roasts also contain fewer of the good stuff, chlorogenic acids, and the other antioxidants that help your blood vessels relax. So in terms of blood pressure, it's a bit of a trade-off. Dark roast, a little bit less caffeine, but less antioxidant power. Medium roast, a touch more caffeine, but more of those heart protective compounds. For most people, the difference is small, so you probably really can still pick the one you enjoy most. Focus more on your total intake than the color of your coffee. What about where do your coffee beans come from? Colombian, Mexican, Ethiopian, Brazilian? Well, the truth is the country of origin has little direct effect on blood pressure. What matters more is, again, how the coffee is roasted and brewed. Dark or medium. Colombian and Mexican coffees tend to be medium-bodied with balanced caffeine levels and rich polyphenols, meaning they fall right in that sweet spot for cardiovascular and blood pressure benefit. Well, how about filtered versus unfiltered coffee? Unfiltered coffee like French press, Turkish, or even your Starbucks espresso, those contain a substance known as diterpenes. These are compounds that can actually raise your LDL cholesterol. Now, that doesn't directly raise your blood pressure immediately, but it's bad overall over time for your vessels. Filtered coffee, drip, pour over, or paper filter machines, that usually removes much of those diterpenes. That means it doesn't raise your LDLs. And finally, how about decaffeinated coffee? For some things, this is the unsung hero of the coffee world, because decaf coffee still contains those same antioxidants and polyphenols, just with very little caffeine, usually under 5 milligrams a cup. That means minimal short-term rise in blood pressure, but nearly all the long-term cardiovascular benefits. And in some studies, decaffeinated coffee has even been shown to slightly lower blood pressure compared with regular coffee. So for people who are caffeine sensitive, if it makes you jittery, anxious, or you think it's affecting your blood pressure, decaffeinated coffee is an excellent option. That's coffee and your blood pressure. If you found this helpful, hit the like button, subscribe, and share this video with a fellow coffee lover who's also watching their blood pressure. I'm Dr. Brian. Thanks for watching. I'll see you in the next one.